Before we start today's lesson, two quick things. First, go subscribe to Pigeon Healthy right now. That's my second channel where I teach natural herbal treatments for every pigeon disease. Canker, respiratory infections, coccidiosis, worms, everything. Natural methods that actually work without chemicals. Link is in the description. Second, I wrote a book called 0 to 500 Kilometers, Complete Young Bird Race Strategy. Everything about training and racing young birds from day 1 to 500-kilometer races. Available in English, Turkish, and Polish. Link in the description on Etsy. If you're serious about young bird racing, get this book. Now today's lesson is one of the most important things I will ever teach you on this channel. Today I'm going to teach you how to read your bird's body, how to examine a pigeon from head to tail, and understand exactly what you're seeing. This is the skill that separates experienced champions from struggling beginners. A champion fancier can pick up a bird, examine it for 60 seconds, and know whether that bird is healthy, sick, ready to race, or needs rest. They can feel muscle condition, assess fat levels, check respiratory health, evaluate eye brightness, examine feather quality, all in 1 minute. This is a learnable skill. It's not magic. It's just knowledge and practice. And today I'm giving you that knowledge. Pay attention, take notes, then practice on your own birds every single day until this becomes automatic. Let me start with why this skill matters so much. Imagine you have 10 birds ready to race Saturday. They all look fine to the casual eye. You basket all 10. Race day comes. 6 birds place in prizes. 4 birds perform terribly. Why the difference? Usually because those 4 birds had subtle health or condition problems you missed during your pre-race assessment. Maybe one had early respiratory infection. Maybe one was slightly dehydrated. Maybe one was carrying too much fat. Maybe one had a minor injury. None of these problems were obvious. But a skilled fancier who knows how to read a bird's body would have caught them, would have kept those 4 birds home. Would have raced 6 birds and had 6 solid results instead of 6 good and 4 terrible. This is what body reading does for you. It filters out birds that aren't ready. It ensures every bird you race is genuinely prepared. Your race results become more consistent because you're not sending compromised birds. You're only sending optimal birds. Over a full season, this difference is enormous. So let's learn this skill properly. We're going to examine the bird systematically. Head to tail, every part has meaning. Every sign tells you something. Let's start with the eyes. The eyes are the window to the bird's overall health. You can learn more from a bird's eyes in 5 seconds than from almost any other indicator. First thing you look for is brightness. Healthy eyes are bright and sharp. They have a glossy quality. The pupil is crisp and well-defined. The iris is vivid in color. When you look at a healthy bird's eye, you get the impression of alertness and intelligence. The bird is looking back at you. It's aware of its environment. It's processing information. Sick eyes look different. They look dull, flat, tired. The brightness is gone. The pupil might be slightly irregular. The iris might look faded. The bird might be slow to track your movement, or it might hold its eyes half closed. These are signs the bird is not well. The dullness comes from systemic illness. When a bird is sick, its body prioritizes fighting infection over maintaining alertness. Energy is diverted from sensory systems to immune function. So sick birds look tired because they genuinely are directing resources elsewhere. Slightly dull eyes versus clearly bright eyes is a subtle distinction, but with practice you'll see it instantly. Handle your birds every day. Look at their eyes. Learn what normal looks like for each individual bird. When you know they're normal, any deviation stands out immediately. That quick recognition is what you're building. Next, look for any discharge around the eyes. Clear watery discharge in small amounts is sometimes normal, especially in dusty environments. But thick yellowish or greenish discharge is a clear sign of infection, bacterial infection, maybe conjunctivitis or respiratory disease that's affecting the eyes. Any thick colored discharge means the bird is sick and should not race. Also examine the skin around the eyes. This skin should be smooth and clean. Rough, warty skin around the eye area can indicate paramyxovirus or other conditions. Red inflamed skin around the eye suggests irritation or infection. Pale skin around the eye can indicate anemia. Shall learn what healthy peri or bulbal skin looks like. Know the difference between normal pigmentation and pathological changes. Shall examine the cere. Shall plead is more mindist insist incision. The cere is the waxy covering at the base of the beak that contains the nostrils. Healthy cere is clean, shall clean, smooth, pale white to light gray in color, and completely dry around the nostrils. Discharge from the nostrils is a major red flag. If you see any moisture, mucus, or crusting at the nostrils, the bird has respiratory disease. Shall plead is more mindist incision. Should never be raced. It's sick, it will perform terribly, and might spread disease to other birds at the race. Also smell the nostrils. I know that sounds unpleasant, but it's valuable. Healthy nasal passages smell like nothing, or very faintly like clean bird. If you smell anything sour, fishy, or foul from the nostrils, the bird has respiratory infection with bacterial growth. The smell is from bacterial metabolism. That smell means antibiotic treatment is needed before this bird races again. Shall beak itself should be smooth and properly shaped. Crossed beaks or deformed beaks indicate developmental problems. Overgrown beaks prevent proper feeding. These birds need beak trimming, or in severe cases culling. Normal beak color varies by bird genetics. Some birds have flesh-colored beaks, others have gray beaks. Know your bird's normal beak color. Shall a bird's normal might indicate something worth investigating. Now move to the inside of the mouth. Open the beak gently by pressing on the sides of the beak from below. Look inside. The interior of a healthy mouth is clean, moist, pale pink, and odorless. Any yellowish growth, white patches, or yellowish cheesy deposits inside the mouth or throat is canker. Canker is trichomonas infection, and it's very common in racing pigeons. Shall birds know beak cases might just be a few small spots. Severe cases can fill the throat. Any canker should be treated before racing. Don't race birds with active canker. Also look for excessive mucus in the throat. Some clear moisture is normal. Thick opaque mucus suggests respiratory infection. Shall birds know beak cases with a mucus buildup? This mucus impairs breathing. Breathing impaired birds race poorly. Now move to the neck and crop. Feel the crop gently. Run your fingers over it from outside. The crop should feel either empty or full of feed, depending on when the bird last ate. Shall cases, it should feel smooth inside. No hard lumps, no excessive gas. Sometimes birds develop sour crop, a condition where crop contents ferment and produce gas. You can feel this as a puffy, gassy crop that smells sour when the bird opens its beak. Sour crop birds are sick and need treatment. If you examine birds in the morning, before feeding, crops should be mostly empty. A bird with a full crop in the morning that hasn't been fed yet is concerning. It might mean the crop is not emptying properly. Slow crop emptying indicates digestive problems or infection. Healthy birds have empty or nearly empty crops by morning. Feel the neck for any lumps or swellings. Lymph nodes in the neck can swell during infection. You can feel these as small firm nodules under the skin in the neck area. Swollen neck lymph nodes mean the bird is fighting infection, not racing condition. Some birds develop tumors in the neck area. These can usually be felt as distinct hard masses. Tumors are serious. Consult a vet. Now move to the chest and keel. This is where most experienced fanciers spend the most assessment time. The keel examination tells you almost everything about a bird's racing readiness. Let me teach you exactly what to feel and what it means. Hold the bird gently, but firmly in both hands. Place your thumb on one side of the keel and your middle finger on the other side. Press gently inward from both sides. You're feeling the breast muscle on both sides of the keel bone. Now slide your fingers along the length of the keel, from front to back. You're assessing muscle thickness, firmness, and fat coverage. Optimal racing condition feels like this. The keel bone itself is palpable. You can feel the sharp edge of the keel running down the center. On either side of this edge, the muscle is thick and firm, dense, like a flexed bicep. The skin moves smoothly over the muscle, without any puffy resistance. There is no soft cushion of fat between the skin and the muscle. When you press on the muscle, it feels solid and springy. not soft and squishy. This is what Belgian champions call sharp keel condition. The keel is prominent. The muscle is dense. No fat. This bird is lean and strong. Ready to race. Now compare to what a bird in poor condition feels like. The keel is there, but when you press inward from the sides, you encounter soft yielding tissue before you reach the firm muscle. This soft tissue is fat. The bird is carrying excess fat between the skin and the flight muscle. Instead of feeling solid muscle immediately, you feel a soft cushion. The keel edge might be harder to feel because fat is covering it. This bird is not race ready. The fat adds weight without adding power. Aerodynamic drag increases. Power to weight ratio decreases. This bird will race below its potential. Now assess muscle mass itself. Put your thumbs on the keel edge and spread your fingers over the breast muscle on both sides. How much muscle is there? Is the breast wide and full with substantial muscle? Or is the breast narrow and flat? Keel prominent because muscle is thin. Adequate muscle mass is essential. Too little muscle and the bird simply doesn't have the physical capacity for sustained racing flight. This can happen from underfeeding, illness, or overtraining. The optimal assessment is this: substantial muscle on both sides of keel, firm and dense, with no soft fat layer between skin and muscle. Keel edge palpable, but surrounded by strong muscle. This is the benchmark. Every bird you race should meet this standard. Just one important note. Keel condition assessment is a skill that improves with practice. At first, the differences feel subtle: soft versus firm, fat versus muscle. It all feels similar when you're new. But after examining hundreds of birds, the differences become obvious. Your fingertips develop sensitivity. You'll feel the difference instantly, so practice daily. Examine every bird every day. Your fingers will learn what they're feeling. After a few months, this assessment takes literally 3 seconds and gives you accurate information. Now check for injuries in the chest area. Sometimes birds sustain impact injuries from hitting wires or other obstacles. These can cause hematomas under the skin, soft swellings filled with blood, or muscle bruising that you can feel as tender areas. Birds with chest injuries should not race. Impact injuries need healing time. Now move to the wings. Extend each wing fully. Check the flight feathers. Primary feathers are the long feathers at the tip of the wing. Secondary feathers are the shorter feathers closer to the body. All feathers should be present, correctly positioned and undamaged. Missing primaries directly reduce flying ability. If a bird is missing one or more primary feathers from molt, it cannot race effectively. The reduced wing surface area limits speed and efficiency. Examine each primary feather. It should be straight, clean, with proper structure. Feathers have rachis, which is the central shaft, and barbs, which are the fibers extending from the rachis. Healthy feathers have tight, interlocking barbs. If you run your finger against the barbs of a healthy feather, it might separate slightly, but immediately zips back together when you run your finger the other direction. This self-repairing structure is essential for aerodynamics. Damaged feathers have broken barbs that don't zip together. They look frayed or ragged. These feathers create turbulence and reduce aerodynamic efficiency. Check for feather lice and mites by parting the feathers near the base. Lice are small flat insects that live between feathers. You might see them moving when you part feathers. Lice cause feather damage and irritation. Birds with heavy lice loads groom excessively and race poorly. Mites might show as powdery residue at the feather base. Treat any infestation before racing. Flex each wing through its full range of motion. Start with the wing extended fully, then flex it toward the body. There should be no resistance, no stiffness, no clicking sounds, no obvious pain response. Wings should move freely through their full range. Any stiffness or restricted movement suggests joint or muscle problems that need investigation before racing. Also feel the wing muscles, specifically the shoulder area. Like the breast muscles, wing muscles should feel firm and developed. Underdeveloped or soft wing muscles indicate poor conditioning or illness. Strong wing muscles are necessary for the sustained, powerful wing beats required in racing. Now move to the back and spine.
Run your fingers down the spine from neck to tail. The spine should be straight, not curved laterally. Deviations from straight can indicate old injuries or developmental problems.
The muscles flanking the spine should be smooth and symmetrical. One side should not be more developed than the other. Check the overall body shape from above. Looking down at the bird, the body should have a streamlined teardrop shape, wide at the chest, tapering toward the tail. This aerodynamic shape is natural to healthy, well-conditioned birds. Asymmetrical shapes, unusual protrusions, or visible structural abnormalities suggest problems. Now examine the vent area. The vent is the single opening through which birds expel waste and reproductive materials. The skin around the vent should be clean and dry. No soiling, no redness, no swelling. Watery stained feathers around the vent indicate diarrhea. This is a clear sign of digestive illness. Birds with dirty vents have active digestive problems and should not race. Also look at the feathers around the vent. These feathers should lie flat and clean. If they're soiled, matted, or missing, investigate. Chronic diarrhea erodes feathers around the vent over time. If you see permanent feather loss in this area, the bird has had chronic digestive issues. The tail feathers should be intact and properly aligned. All 12 tail feathers should be present and positioned symmetrically. Tail feathers provide steering during flight. Missing or damaged tail feathers impair maneuverability. Broken tail feathers can be repaired with feather splints in emergency, but ideally birds race with complete intact tail plumage. Now examine the legs and feet. This is often overlooked but extremely important. Healthy legs are clean, smooth, and appropriate color for the breed. Some birds have feathered legs, others have clean legs. Know what's normal for your birds. Feel the leg bones. They should be straight and smooth. No lumps, no deformities. Run your fingers down the leg. Any swelling could indicate injury or infection. Bumblefoot is a bacterial infection of the foot pad that creates painful swollen growths. Affected birds are in pain. Racing in pain means distracted, unmotivated performance. Treat any foot problems before racing. Check the toes. All 4 toes should be present and properly positioned. 3 forward, 1 back. All toes should be straight and functional. Injuries can cause crooked toes. Some birds are born with toe deformities. While not always performance limiting, unusual toe structure is worth noting. Feel the foot temperature as discussed in previous videos. Warm feet indicate strong circulation. Cold feet indicate compromised circulation. Race birds with warm feet. Investigate birds with cold feet. Check the nails. Nails should be a reasonable length. Very long nails can impair perching and create discomfort. Nails can be trimmed carefully with appropriate clippers. Don't cut into the blood vessel inside the nail. Cut just the tip. If uncertain, ask a vet to demonstrate proper nail trimming technique. Check for leg rings or bands that have become too tight. As birds age and their legs grow, bands that fitted correctly as babies can become constricting. A band that's too tight cuts off circulation and causes pain. If you see a swollen leg above a band, the band is too tight. Have it removed by a vet immediately. This is a welfare issue. Now check the plumage overall. Standing back and looking at the bird, what impression does the plumage give? Healthy birds in racing condition have tight, sleek feathers lying close to the body. The feathers are glossy. There's a slight iridescence in good light. The overall impression is compact, streamlined, athletic. Birds in poor condition have rough plumage, feathers fluffed out, no gloss. Sometimes individual feathers are bent or misaligned. The impression is scruffy and unwell. This rough appearance often comes before other obvious symptoms appear. The feathers are an early warning system. Feather quality depends on nutrition, health, and molt status. Birds in active molt look rough because they're growing new feathers and old ones are being pushed out. Don't race birds in heavy molt. Growing feathers are blood-filled and fragile. Heavy exercise during active molt can damage growing feathers. Wait until molt is complete before resuming serious racing. Now check the bird's weight. You need a digital scale accurate to 1 gram for this. Weigh each bird at the same time each day for consistency. Ideally morning before feeding, as discussed in previous videos. Record weights in a logbook or phone app. Track weight trends over time. Healthy racing weight varies by bird frame size. Small framed birds might be 300 to 320 grams. Medium framed birds, 320 to 340 grams. Large framed birds, 340 to 360 grams. These are guidelines, not absolutes. You need to know the optimal weight for each individual bird. This comes from tracking performance against weight over multiple races. When a bird races its best, what was its weight that morning? That becomes its target racing weight. Weight changes tell you important things. Gradual weight gain over a week without dietary change might mean the bird is building muscle from training.
Ox.
This is positive. Sudden weight gain in 1 or 2 days might mean the bird is carrying water, possibly from kidney issues. Weight loss of more than 15 to 20 grams over a week suggests the bird is either sick, being underfed, or being bullied away from feed. Now let me teach you how to assess breathing.
Ox.
Normal resting breathing is almost invisible. The bird's body moves very slightly with each breath. Breathing is quiet. You cannot hear it unless you listen very closely in a quiet room. The respiratory rate at rest is about 25 to 30 breaths per minute. Pick up the bird and hold it gently. Feel its rib cage. You should feel subtle rise and fall with each breath. Count the breaths per minute if you want to track this. After exercise, breathing rate increases dramatically. This is normal, but it should return to resting rate within 5 to 10 minutes of rest. If breathing remains elevated long after exercise stops, cardiovascular fitness is poor. Listen for any sounds. Hold the bird close to your ear in a quiet environment. You should hear nothing, or at most a very faint soft sound of normal breathing. Any wheeze, rattle, click, or abnormal sound is respiratory disease. The types of sounds give clues to the disease. Clicking suggests canker in the throat or airways. Wheezing suggests inflammation and mucus in the airways. Rattling suggests fluid in the air sacs. Any abnormal respiratory sound means don't race this bird. Treat the underlying condition first. Sometimes respiratory disease is only obvious when the bird exerts itself. A bird might seem to breathe normally at rest, but wheeze during or after exercise. This is important to catch. During loft flying sessions, listen to birds as they fly. Listen when they're breathing hard from exertion. That's when subtle respiratory problems become audible. You might not hear it when they're sitting quietly, but you'll hear it when they're working hard. Now let me teach you the complete pre-race assessment routine. This is what I do before every race. It takes about 3 minutes per bird. On race Friday starting at 6 a.m., I examine each potential race bird individually. First, observe the bird in the loft before catching it. How is it behaving? Is it active? Eating well? Interacting normally with other birds? Or is it sitting quietly, fluffed, inactive? Passive observation before handling tells you a lot. If the bird looks off before you even touch it, that's a sign. Second, catch the bird calmly. How does it respond to being caught? Healthy birds resist being caught. They try to escape. They're alert. This is normal. A bird that lets itself be caught very easily, without resistance, is concerning. Excessive tameness can indicate weakness or illness. The bird should have some fight in it. Third, hold the bird gently. Feel its overall body tension. Healthy birds have muscle tone. They're not completely limp in your hands. They have some resistance, some spring. Sick birds feel limp, floppy, heavy. Fourth, examine eyes, brightness, discharge, periorbital skin. 5 seconds. Fifth, examine nostrils and cere, dryness, discharge, smell. 10 seconds. Sixth, open the beak. Look inside, canker, mucus, clean pink tissue. 10 seconds. Seventh, feel the crop, empty or appropriate fill, texture, gas.
5 seconds. 8.
Feel the keel, muscle condition, fat levels, sharp or rounded. This is 15 to 20 seconds. Most important assessment. Take your time. Ninth, check wings.
Extend each wing briefly. All feathers present. Any obvious damage, 10 seconds. 10th, check vent, clean or soiled, 10 seconds. 11th, check feet, temperature, injuries, cleanliness, 10 seconds. 12th, check weight on scale, compare to previous week, and target weight, 10 seconds. 13th, put bird down.
Observe it walk and move. Any limping, any movement abnormality, 5 seconds. Total time about 3 minutes per bird. For 10 birds, 30 minutes, worth every second. This 30-minute assessment can identify problems that would ruin your race performance.
You're not guessing whether birds are ready.
You're assessing each individual scientifically and making informed decisions. After the assessment, categorize each bird: excellent condition, ready to race; good condition, race with confidence; marginal condition, race if you have no better option; poor condition, do not race. Only birds in excellent or good condition should enter the race basket. Marginal birds should stay home, unless you're very short on race team numbers. Poor condition birds never race under any circumstances.
Keep records of your assessments.
Write down what you found for each bird each week. Over time, this creates a health and performance database. You can look back and see patterns. This bird always performs best at 330 grams. This bird tends to have crop problems in wet weather. This bird's keel condition drops off during molt. Patterns guide your management decisions. Let me now explain what different combinations of signs mean, because individual signs don't always tell the whole story. It's the combination that gives you the full picture. Sharp keel plus bright eyes plus clean nostrils plus warm feet plus perfect droppings. This is a bird in peak condition. Race with full confidence. This is the combination you're working to achieve in all your race birds. Slightly rounded keel plus bright eyes plus clean nostrils plus warm feet plus slightly loose droppings. This bird is slightly heavy and has mild digestive variation. Probably fine to race, but watch for performance slightly below its peak. The digestive issue might be dietary or might be very early infection.
Monitor.
Sharp keel plus dull eyes plus slight nasal discharge plus warm feet plus green droppings. This bird has early infection, probably respiratory. The dull eyes and nasal discharge confirm it. The green droppings show digestive involvement. Do not race. Separate and treat immediately. Caught early, this is easily treatable. Missed and raced, it becomes severe. Sharp keel plus bright eyes plus clean nostrils plus cold feet plus normal droppings. This bird has circulation problem, despite good nutrition and health. The cold feet indicate cardiovascular issue. Could be anemia, dehydration, overtraining. Don't race until cause is identified and addressed. Rounded keel plus dull eyes plus clean nostrils plus cold feet plus loose droppings. This bird is in poor overall condition. Subito's nasal flustums are compromised. Complete rest. Full diagnostic workup. Something serious might be developing. This bird doesn't race again until all indicators are back to optimal. The more indicators that are positive, the more confident you can be in racing. Subito. The more indicators that are negative, the more certain you should be to keep the bird home.
One negative indicator might be minor.
2 or 3 negative indicators together paint a clearer picture of a compromised bird. Now let me address the emotional difficulty of this assessment. Sometimes you have a bird you really want to race. Maybe it's your best genetic bird. Maybe it's won before. Maybe the race is important and you need your best birds. But the assessment shows it's not ready. Subito marginal condition, and you're tempted to race it anyway.
Subito, don't do it. I've made this mistake many times in early years.
Race birds I knew weren't quite right because I wanted them in the race. The results were almost always disappointing, and sometimes the race made the bird's condition worse. A bird in marginal condition that races can come home in poor condition. The race stress pushed it over the edge. Recovery takes longer. The next race, it's still not right. You've now sacrificed 2 or 3 weeks of potential racing for this bird because you rushed it back before it was ready. Better to miss one race, Rest the bird properly, get it to full condition, then race it at its best. One race missed and rested is worth more than 3 races entered in marginal condition. Champions think long-term. They protect their bird's condition. They don't sacrifice future performance for present impatience. Let me give you one final important piece of advice about body reading. This skill only works if you practice it daily.
So be dom disted do. Modul and temian tens you.
Modiview bird daily handling and assessment builds 2 things simultaneously. First, you build your own skill. Your hands and eyes get trained. You become more accurate. Second, you build a baseline for each individual bird. You know what normal feels like for each one. So abnormal stands out immediately. Fanciers who only handle birds on race day struggle with assessment. They don't know what normal feels like for that individual bird.
So they can't detect subtle deviations.
Everything seems roughly normal because they have no reference point. Fanciers who handle birds daily know each bird intimately. They know this bird's eyes are normally this bright. This bird's muscle normally feels this firm. This bird normally weighs exactly this much. When anything changes even slightly, they notice that immediate recognition of change is early detection. Early detection saves birds and wins races. So start today. If you haven't been handling your birds daily, start now. Pick up each bird. Run through the assessment. Get to know each individual. Build your database of normals. Within a month, you'll be dramatically better at this. Within a season, you'll be doing it automatically in 60 seconds per bird. And you'll be keeping sick birds home while racing only your best. Your results will improve. Your birds will be healthier. You'll be a better fancier. This is what I want for you. This is what this channel is about, teaching you the skills that turn average fanciers into champions. Body reading is the foundation of those skills. Master this and everything else becomes easier. You'll know which birds to race, which to rest, which to treat. You'll stop guessing and start knowing. And that knowledge is what wins races.